Welcome. I'm here with Dr. David Segal, Professor of Medicine, a world-renowned orthopedic surgeon and inventor of a revolutionary new concept in back support, the hug by koala. Dr. Segal has over 30 years of clinical experience, including positions as Director of Orthopedic Surgery at Boston City Hospital, Professor at Boston University and Hebrew University, and Chairman of the Orthopedic Surgery Department at Hadassah Medical Center. Dr. Segal is widely published in professional journals and is a member of international orthopedic societies. He leverages his clinical knowledge to develop healthcare products and has successful knee and ankle products credited to his name. Hello, Dr. Segal. You are a respected orthopedic surgeon. How did you get involved in inventing the hug back support?
An orthopedic surgeon takes care of many patients with lower back pain. Only a small minority requires surgery. The majority are treated with pain medication, exercises, and back supports. The available back supports are all involving wrapping around the abdomen, which I think is unnecessary, it's not comfortable, and I thought of developing a new device, the hug, which will eliminate the wrap around the abdomen.
Could you explain how the hug helps a person suffering from back pain?
Yes, I will show you. The hug lower back support puts pressure, gentle pressure, on our lower spine. This is our lumbar area. In addition, it is anchored in the front on our pelvic bones, one here and one here. And it keeps the front, the abdomen, free. All the other back supports are providing lower back support, but they have to be wrapped around the abdomen. And our dynamic hug support keeps the abdomen free, and it also trains the muscles, the core muscles of our lower back, to maintain the proper tone, to be in good shape, and keep the proper posture, which is the erect position.
What is the lumbar lordosis and why is it important?
Normally, we have three curvatures in our spine. I'm going to show it to you. In the area of the neck, we have the cervical lordosis, which curves forwards. At the rib cage, we have a curve which goes backward, and it's called the kyphosis. And at the lumbar spine, this is our third curvature, we have one which moves forward, and it's called the lumbar lordosis. The lumbar lordosis is the most important curvature of all three of them, which maintains proper position of our spine.
What does posture have to do with back pain?
A lot. Bad posture is back pain. If you want to reduce back pain, you have to improve your posture. To improve your posture, you need better muscles, you have to stand and move better, and you have to maintain good muscle tone. Improve your posture and you reduce your back pain. That's the clue.
People have been using wraparound back supports for generations. They do the same thing, don't they?
Well, people have been using wraparounds for generations, in my opinion, because they have no alternative. There was nothing else available on the market. So you use what's available. But the wraparounds put pressure on your abdomen. Yes, they do provide some lower back support, but you pay a price for it. And the price is intra-abdominal pressure, difficulty to eat, difficulty to breathe, uncomfortable sitting, and when you have no alternative, you have to use it. That's why we came up with an alternative, which wasn't available up till now. Now that there is one, I think people will see the light and change from the wraparound to the hug lower back support.
Wraparounds are usually worn under clothes. Why is the hug worn over clothes?
The dynamic hug lower back support, it's like a belt. You can wear it over the clothes or you can wear it under the clothes. But it's aesthetically acceptable, projecting the image of health, dynamic activity, and strength.
What would you advise a person with lower back pain?
My first advice to a patient with lower back pain is make sure that you have a medical checkup just to be sure that there's no underlying condition which causes your back pain. Once you're told there's nothing wrong with you except the lower back pain, which is a natural evolutionary process, then you should train yourself. You should have proper posture, good muscle tone, maintain lower weight if possible, and be active. In my opinion, the key to reduce lower back pain, which cannot be eliminated but only reduced, is being active, good posture, and good muscle tone. We try to achieve all these by using the dynamic hug lower back support, which in addition to maintaining your proper posture, also gives you an element of training, which is very important. Be active participant in reducing your lower back pain, and you will succeed.
How do you recommend using the hug? Are there any limitations in using it?
The hug is a dynamic lower back support, which means that you have to use it first gradually, get used to it, and you have to cooperate. It's not a static thing that lies on your lower back. It's a dynamic thing. Change your posture. Move away from the pressure of the lower back. Straighten up your spine and tighten your muscles. It's a training as well as a maintaining lower back support. You use it properly, you'll improve your posture, you'll improve your muscle tone, and you will improve your lower back pain. But it takes time, and use it gradually as instructed.
What about sports? Can the hug be worn while running, biking, or playing golf?
I think that's the only back support you can use in sports because it keeps your abdomen free. You can use it golfing, biking, running. The hug lower back support will not prevent you from doing your physical exercises, except one thing. We do not recommend to use it in contact sports for fear that you may injure yourself or your opponent. Otherwise, use it and enjoy it.